So it's especially wonderful to be back here, because if I remember the Aparna Hegde of first MBBS or second MBBS, and especially third MBBS, if somebody had told her that I'm going to come back here and stand on this side of the stage and give a talk on my journey in medicine, I would be extremely surprised. Because, yes, I was introduced as India's leading urogynecologist, and I've also founded one of India's largest mother and child health NGOs. But in third MBBS, if anybody told me that I would be doing that, I would be really surprised. Because journeys don't start always, with success. There are many steps along the way to that. And I want to share with you my journey in a medical conference, because I think medicine is not all about, all that we succeed. It's about what leads to that. And honestly, for me, MBBS was not really the best time of my life, right? So I'm going to take you through a journey on that, because Sion Hospital was a place where I had the worst experiences, but also Sion Hospital was the place where I had the best experiences in my life, which led to where I am right now, right? So let me share that journey with you. Can you tell me what this slide is? My biochemistry teacher is here, and when I was in first MBBS, I knew nothing about this. But can anybody ever tell me what this pathway is? In a medical conference, it's very important to ask this. This is basic science. Can anyone tell me what this pathway is? A clue. You heard so much about fat people in the last lecture, right? This is or chain fatty acid metabolism pathway. How many of you have read this pathway in first MBBS? How many of you remember in third MBBS? This pathway, the knowledge of this pathway saved my life. I'm serious about this. So, why do we enter medicine? Why did any of you enter medicine? What is the reason for entering medicine? One or two of you. Why did you enter medicine? Why did you want to become a doctor? Is it because you got more marks? Or because you like the sciences? Why is it? I entered medicine because I really looked at medicine as a pathway to service, science, and research. I was a really good student till 12th standard, and for me, I was a math student, a physics student, but really thought of medicine as a way to give back to society. Honestly, I was always considered myself extremely lucky to be a Mumbai girl, I mean, a Mumbai girl growing up in middle class Indian socialist India of those times, the kind of education we get, the kind of facilities we get, and the kind of hospitals we come to study is extraordinary. I really felt that I had to give back because it's an accident of birth. And for me, medicine was really a way of giving back, right? And next was science and research. How many of you know these four people? Who are these four people? Who are these four people? This photograph really inspired me. When I was a young girl in 10th standard, I read about the history of Johns Hopkins. These are the big four: Osler, Halstead, Welsh, and Terry. Have you heard of them? Osler was the one who started medical residency. He was a great guy of medicine in Johns Hopkins. Terry was the father of gynecology. Halstead was the father of surgery. And obviously, Welsh, pathology, right? If you read their histories, it's extraordinary how medical science, they brought medical science to where it is. And the journey of these pioneers in medicine is full of, it's like, rocket science is nothing compared to what they go through. And their stories really inspired me. I really thought that medicine is a way where, I love science. And I thought that I could come back, it's a field which would allow me to add to literature, it allowed me to take the science forward. It will help me become a researcher. I could do things that could leave a mark behind, right? Like things I come up with can impact lives for centuries ahead, even if I'm not alive. So science, service, and research was what got me to Sion Hospital. When I was doing 10th standard, everyone wanted to be an engineer. But these three things made me want to become a doctor. But then first MBBS met him. All of us know him, right? All of us know him. And really, honestly, Chaurasya, I really respect him. But it is but that's not any knowledge of the kind of education I went through, what I felt compelled to do in order to become a doctor. Right? I had to study a lot. I had to know everything by heart. I had to, the rote learning system really had to be adhered to get me the marks to go and achieve what I wanted to do. Right? But for first, second, third MBBS, I lost interest. The second thing that happened was that the thing that I did not know was when I was 18 and I entered MBBS, I developed Hashimoto's thyroiditis. Right? So Hashimoto's thyroiditis, you know all of it, it's an autoimmune condition. And I spent the entire MBBS and MD undiagnosed in Sion Hospital. And when undiagnosed, precisely for the reason that, in medicine, we don't have empathy for each other, because we're so busy, we're so hardworking, and all of us are so in our own world, all of us suffering so much, we can't look at our next door neighbor, right? Secondly, very importantly, what happens is, how we learn medical science is that we look at symptoms in science, one thing leads to the other, we do some diagnostics and we come to a treatment, right? So in first MBBS, I couldn't write. I used to get muscle in coordination. I would not finish my papers, and people would laugh. I would, go through my exams, never finish them. I had a teacher, I remember in physiology, who told me that I lose 1 mark at least every answer because of my handwriting. And no one realized that I was developing muscle in coordination, right? I used to get menorrhagia. I only remembered menorrhagia all my life. And I went to gynecologists, and they would keep looking at it, giving hormonal treatment, etc. I would get carpal tunnel kind of symptoms before exams, and people would tell me, carrying heavy MBBS books, walking around, you must be developing symptoms like carpal tunnel. I used to get big joint pains before exams, and everybody again thought that, you go to an orthopedic person, you go to a gynecologist, you go to a medicine person, then you end up going to a psychiatrist, because all of these symptoms don't add up to something. Right? And that's my journey. In third MBBS, I really, before my final MBBS exams, it was like one whole 2 months of exams. You know what it is to a Hashimoto's thyroiditis patient? It really kills you, because what happens is that you're anxiety-ridden, and the stress can lead to cracks and troughs in the condition. And the only thing I remember after my third MBBS is depression through my MD days. Really, I was very hardworking. I'm sure all my teachers here would remember me has been, hardworking student. But it was the worst thing on earth, because the only thing I remember is depression and muscle ache and fatigue. And if you ask anybody else, even they are depressed. If you ask anybody else, everybody has got muscle ache, right? And then it is only after I finished my MD Gynac that it came out. It was just minutes before I entered into myxedemic coma that I was picked up to have Hashimoto's thyroiditis. Because suddenly one fine day, my voice started getting more and more hoarse, and my blood pressure dropped, and I was picked up. And I couldn't diagnose myself because I was 18 when I got it, and along the way, that was me. If you ask my MBBS friends, they're going to tell you that Aparna Hegde is the anxious sort, right? Because that is what I've become because of Hashimoto's, right? Exam tension. And so everything, all the symptoms I had reasons for it. Depression because of personal problems, right? And you wouldn't believe it. I got picked up, and then what happened is that I got my, I was put on, I was hospitalized, was given thyroid medication, etc. And then what happened? A year and a half more of horrific symptoms. More severe depression. I had blurring of vision. I had, tingling numbness of my arms. I had a lot of neurological conditions. And the one thing I really had was a lot of fatigue. Every time I ate anything fatty, what would happen to me was complete energy loss. I just couldn't get up from bed. And I would go back to the endocrinologist and say, look, you're treating me with thyroid medication, but I'm not better. Why am I getting tingling numbness? Why am I getting, it was like projectile vomiting, literally. And no clues, no answers. And that's when that pathway helped me. You know what I did? Because after I finished my MD, whole through MBBS MD, I was not happy with myself. I had gotten enough marks to get to MD Gynac in Sion Hospital. I was doing reasonably well, though I was not the best student in the class. I was not used to it because I was upwards of 12th standard, but I was doing reasonably well. No teacher would think that I was a bad student at that time, right? But I knew within myself that I hated where I was, because MD Gynac, you can do gynecology, forgetting everything about basic sciences, right? You could you didn't feel like a doctor because you're operating, because you can operate if you know the steps of surgery. You don't need to know the science behind that much. It was just doing day in, day out patients, and I didn't like it. So one thing I did after I finished an MD Gynac was to go back to my books. I reread every basic science subject. I now know biochemistry like the back of my hand. I read my physiology, read my biochemistry, and the one thing I realized, and that really saved my life, you know how? Because when I recovered from my Hashimoto's thyroiditis, and I went in these horrible symptoms where I used to get projectile vomiting, you know, this horrible fatigue when I ate fat and projectile vomiting. The thing you do when you have projectile vomiting or any kind of vomiting, you start eating less fat. You only eat dal chawal, correct? And I realized the day I ate dal chawal, I was good. And the day I ate anything fatty, I was bad. I went and told my endocrinologist, look, when I eat fatty stuff, all the symptoms are terrible. She couldn't make out what was happening. She actually told me that, you know, your body is like, you know, a rust-ridden cycle. It has been without thyroid medication for years on end. So now when you're taking thyroid, body is getting used, not used to it, so it's taking time to get used, you know, adjusted to thyroid medication. And luckily, I remembered or-chain fatty acid metabolism. I had never studied it during first MBBS because it's not supposed to be something you study for the exams. Right? But I'm going to go back to the or-chain fatty acid metabolism. You know how this helped me, the knowledge of it helped me? It's because in or-chain fatty acid metabolism, you get a last 3C propionyl coenzyme A, right? Normally when fatty acid gets broken down, you have acyl coenzyme A, right? Because they all even chain, they come down to acyl coenzyme A, right? And they enter the Krebs cycle. But you have one propionyl coenzyme A, right? My biochemistry teacher is here, correct? And for propionyl coenzyme A to enter the Krebs cycle, it has to go through a pathway that requires B12. Because propionyl coenzyme A has to become methylmalonyl coenzyme A, that has to become succinyl coenzyme A to enter the Krebs cycle. I remembered it. I went back, I did my propionyl coenzyme A levels, I did my methylmalonyl coenzyme A levels, I did my B12 levels. I was inches away from really getting neurological damage. Because my B12 levels were really next to nothing, and my propionyl coenzyme A levels and methylmalonyl coenzyme A levels were sky high, really. And that saved my life. Honestly, basic science saved my life. And this is what I really want to tell you guys. You know, the day I discovered this, you know, I really had an epiphany. I wasn't where I wanted to be. If you look at me that time, if my colleagues from Science Hospital were to see this lecture and think that Aparna Hegde was not happy with where she was, they were surprised. Because on paper I was doing pretty well, right? I was a good student, so I mean that saved me through the thyroid days. I was publishing papers in Gynac. I had trained to become a laparoscopic surgeon, but I was nowhere where I wanted to be, right? Science, service and research. I was doing nothing of those things. I was a laparoscopic surgeon. I was looking forward to a life of, you know, I was doing laparoscopic surgery day in, day out and get name, fame and money. But it wasn't what I wanted to do in my life. But the good thing about this is the lightness of failure. When you are the lowest ebb, you really have nothing to lose. Right? Because of my years of depression to the thyroid, you know, you don't have thyroid medication, you don't have the dopamine in the body, right? So you don't, so years of depression to just not be depressed. Such a wonderful feeling, to be not ill, but such a wonderful feeling, to not have muscle ache. You know, when it is like amazing to be alive. I couldn't imagine being alive was so easy. Right? I mean, nothing is worse than being ill and not being aware of it. Right? To not have muscle ache, to not be fatigued, and not to be healthy was just the, you know, impetus I needed. I just decided to go behind what I really want to do with my life. Right? And the best way to stay above the rat race is actually drop out of it. So I dropped out. At the age we're supposed to get established, you know, I mean, I was already, you know, I mean, you finish your MBBS at 24, 25, and then 28, and then 27, you've done your MD, right? And then I did laparoscopy surgery, then I came back as a lecturer. So by the time I finished all of those things, a routine thing in a student's life, I was only 32, 33, right? At 32, 33, supposed to get married, have kids, correct? And then I decided I'm just not happy at all. I just said, it doesn't matter what age I am, it doesn't matter I'm a single woman, I'm going to go ahead and claim my destiny. So then, the first thing I did, because I'd already done my basic sciences, and I realized to myself how when a patient walks in, I really don't know whether I'm doing the right thing by the patient because I'm not really, completely in control of the knowledge I require to be able to treat her. Like I was a gynecologist, but I had a condition which I didn't know until I studied, right? So I went and did my master's in biological science at Stanford. I really wanted to do research. So I went back, did a master's in Stanford. It was amazing, to study basic sciences from the world leaders. And to go to a place where science is science, where you're studying something not for the marks, but because of the knowledge behind it. Those take-home exams, they're fantastic. I was 35, and I had to go after 5 years. When I got out of my thyroid, I got out of my B12, I had to actually postpone Stanford for 3 years because I was so ill, because I had, my body had taken such a lot of, beating because of all the illness I had gone through. And so I postponed for 3 years. They postponed for me. They didn't even know why. They just wanted to give a chance. Luckily by then I had a lot of publications in laparoscopic surgery in international journals because I always fancied myself as a researcher, and I'd done a lot of study on my own. It was all self-read. I came to a point where Stanford was ready to wait for me. And to study those conditions, those subjects from the world's masters really opened my mind enough. And what happened then was I done my USMLE. I did my USMLE at a really later age, and I decided that I'm actually going to go into urogynecology because my interest in urogynecology came in because Science Hospital is a field where is a place where you have a lot of vaginal surgery. So I done a lot of vaginal surgery, but I also want to combine vaginal surgery, laparoscopic surgery with basic science, and physiology is an amazing subject. And urogynecology is a subject field where you really marry the basic sciences with surgery. It's a field which is both medicine and surgery. And when life supports you, when you want to, when you really put everything aside and go on your path. So I won the International Urogynecology Association Fellowship, which is given to one person every year, and I ended up in Cleveland Clinic. At Cleveland Clinic, see how life gives you what you want. At Cleveland Clinic, there was this machine there. You know how science progresses? Now ultrasound for babies is the usual thing, right? Everybody knows how to scan babies and how to pick up congenital anomalies. But there's a time when somebody actually scanned a mother's womb and said, oh, you can scan it. Or you can see a baby. And if you can see a baby, then what's the normal features of a baby and what's abnormal? Somebody did that, and that's why science progressed. And what happens normally is that technology, as it progresses, science progresses. So ultrasound technology has progressed such a level that you can now actually see the pelvis. But then it's really the ones who initially do it, it's very hard because you see a mass of stuff, you can't really make out anything. And Cleveland Clinic is a place where all of these new research happens, and if you're somebody interested, there's a whole playground there. And this machine, this is a BK Medical Analogic machine, which is a really highest frequency ultrasound. They are the ones who provide pistols for all the other companies. It was just lying there in Cleveland Clinic since 2008. And nobody was actually, doing any research on it. And luckily what happened was that I said I will actually do research. And the good thing that happened was that my mentor, I can't really tell you what mentorship means. My Cleveland Clinic mentor, he just gave me a free hand. He said, whatever you want to do. He realized very early on that if he gave me the platform, I would build on it. Right? So, I'm lucky to do this, that I've actually become one of the 5 researchers in the world working in the field of pelvic floor ultrasound, where you can now look at the levator muscle, the pelvic floor muscle. I can actually see the pelvic floor muscles, different layers, and I can see the damage that occurs in pelvic floor muscles during childbirth. Right? I can now, that's where the science is going, that you can see the pelvic floor muscles before delivery, after delivery. You can actually prognosticate which woman is going to require C-section because of pelvic floor damage. I can understand which woman can actually end up getting prolapse later on. Then we do sling surgery, where in women with incontinence, we put in a piece of mesh, right? And that mesh cannot be seen on MRI. So, my research has become, it's a very commonly done surgery, so come up with protocols on how to image that mesh. What is a normal sling, what's an abnormal sling, what are the things to look for. All of that has become my research work. And luckily, that's the thing, if you follow your heart. In the 2013 Las Vegas American Urogyn Study Conference, I had 7 oral podium presentations in the main session, and I had the best paper award. And now, now, I'm teaching internationally this particular, it's my field. So, I ran behind the research aspects of it and hoping that one day I can even do basic science, but this has become my research field. So, what I didn't have in the 20s, I am getting it now in the 30s and 40s. And this is the award, Best Paper Award, American Yoga and Study Conference. And it was very, for me, to be able to stand next to these Matt Barber and, the lady from Dr. Sands from Maggie, Pittsburgh, these are the researchers in the field, and to be able to get an award. I used to sit in India and see their papers and really want to be like them, to be able to get an award standing next to them, and to consider them thinking that my research was worthwhile, was really something that was, honestly a big impetus to my soul. And I came back now, so the whole, after I finished residency in fellowship in urogynecology, I've come back to India and hoping that I've created a center for urogynecology and pelvic health, and the next plan is obviously I have to create a fellowship and to do research in it. Urogynecology is very new to India. But what I've come really to talk to you about is Arman. I told you, like medicine is science, service and research, and I really felt very closely that even though I was doing residency in Science Hospital, I didn't really add to the women's lives. I felt that, it is not enough to do heroics in the emergency room. Women will come dying, children will come dying, and though you feel great about yourself because you're saving lives and doing late night sections and doing massive scale, surgeries, it's not enough. If you really want to impact lives, you have to go into the field. And luckily, when I came back to Science Hospital, Dr. Albina Fernandez was the Dean of Science Hospital, and she started an organization called Sneha. And Sneha, the first program of, and this is where mentors play a role. She just realized that this is somebody who can add to her, NGO. So she came to me and said, can you work with me? And then, because I was an activist all my life, and I used to volunteer with other organizations like Akanksha and education, etc., I said, why not work in the field of health? And with Sneha, I wrote the City Initiative for Newborn Health. I designed the program to overhaul Mumbai's public health structure. And that led to me an experience of understanding what's really going wrong in the public health space. Because as a gynecologist, I'm a clinician. I'm a full-time urogynecologist, I'm a full-time practicing doctor, and I'm a researcher. But what I realized is that if you really want to kind of help people at scale, what you really want to do is to create programs at scale. Right? Now what's happening in India is that most NGOs, public health NGOs, are community partners. They work in the slums of Mumbai, they work in a few villages in India. Unfortunately, what happens is that you create very resource-intensive programs. And these programs are so resource-intensive, though they create impact in small areas like Dharavi, etc., they're not immediately scalable because they're too expensive. And so very early on, honestly, what happened is that I realized that when I was doing residency, you would be seeing a lot of problems while you were in medicine, right? So in residency, one problem I saw closely was that I was in antenatal clinics that are really busy. 200 patients waiting outside, no time to counsel them, right? I had situations where women would come, they waited for me for 3 hours, and the only time I can give them is 2 minutes, and I have not been counseled them. And the same patient comes back in delivery, dying. Why? Because she never came back. Right? She didn't come back because she didn't understand why she had come back, what are the danger signs, what are the complications. And what happened was that when I was doing Sneha's work, I suddenly realized that I had ideas for all the problems I had seen. And the one problem I saw was this, lack of access to preventive care information. The fact that I was not counseling my women, and that's why they're not coming back, and they're coming back dying. And suddenly that time, the mobile phone came into India. Right? And the mobile phone came into India within a couple of years, everybody had a mobile phone, literally. Right? So I suddenly realized, why couldn't we use a mobile phone to reach across to women with information they need, when they need it, directly, and not through intermediaries. Because if they go to doctors and go through health workers, they don't have the time or the inclination. And suddenly, out of nowhere, it's serendipity. I was always a maths and physics student. I went into medicine. I missed maths and sciences. But now, Arman has become the Tech for Health NGO, the largest Tech for Health NGO in the country. So, 2008, I realized that you have to create scalable programs, right? You have to create programs that are less resource intensive. They're objective programs with very objective outcomes, and they're designed in such a way that at 1.5 million women, the impact is same as in 1 million. Like you find the balance between depth of impact and scale. And so the MNITRA program was the, become a flag bearer of that. So what we do is, it's a free voice call service. right? So what happens is that everybody has a mobile phone, so we enroll women directly in the hospitals and the slums. It's a free voice call service that sends timed and targeted preventive care information directly to the phones of the enrolled women through pregnancy and infancy in their chosen time slot and language. Right? So what we do is, we enroll women. If you go to Sion Hospital antenatal clinic, we have a health worker station there. So Arman has a health worker station there. And so at the first antenatal visit, we enroll her. We take, but women come to the hospitals too late. So we formed partnership with almost 48 community partners, and we have got Sakhis. You know, women from the slums who know the area. If you go to Dharavi, there are 8 Sakhis enrolling. Right? So they enroll women very early in pregnancy. Right? So these Sakhis are also incentivized. They get money for enrolling women. So the kind of enrollment, what we do is we take their phone number, gestational age, choice of time slot, and language preference. You're more likely to listen to the call if you know. If I suddenly call you now, you're not going to pick up the call. You're listening to me speak unless it's boring. But normally, if they give a time slot choice, you don't know the phone call is expected. Right? So we have 145 voice calls. It's through pregnancy twice a week, once a day in the first 7 days after birth, twice a week till the child is 3 months of age, and once a week till the child is 1 year of age. So 145 voice calls, hand-holding the woman through pregnancy and infancy. Right? And also in the chosen time slot, we call her 3 times. So suppose Monday we'll call her 8 to 9 a.m. If she's given 8 to 9 a.m. time slot, she doesn't pick up the call, then again Tuesday we'll call her, doesn't pick up the call, again Wednesday we'll call her. So we have got 3 tries for every message, and if she's missed all the 3 tries, then we have a missed call system. Right? So the woman can give a missed call system will call her back. We also have a call center. Right? So if she's delivered and she wants to switch to infancy messages, she's aborted, she wants to stop the messages, she has changed her phone number, time slot tries to be changed, she can give a missed call to the call center person will call her back. So M-Mitra now has become one of the largest M-Health programs in the world. Right? So we are reaching across to 16 lakh, 1.6 million women in 9 states. And we formed partnerships with almost 100 partner hospitals, and we've got partnerships with almost 43 community NGOs. And we've got 8,000 Sakhis all through Mumbai, metropolitan region, Delhi NCR, Madhya Pradesh. 8,000 Sakhis who are earning money. So they are earning around 5,000 to 15,000 rupees a month for enrolling women into the program. And you know, we've also added customized programs on top of it. So basically what happened is that M-Mitra goes on to a child is 1 year of age. But women, of course, want information till 5 years, because when you give information, it's empowering, you know. The beautiful thing that's happened with M-Mitra is that, you know, I thought when I started M-Mitra that women will listen to the voice calls and act upon it, you know, voice, knowledge recall and behavioral change. But one thing that's leading to is women empowerment, right? If you give information, it empowers them. They want to know more, right? So the thing came from the field itself, that why don't we increase the program till the child is 5 years of age, right? So malnutrition rates in the country are huge. Almost 45% of children in Delhi, Mumbai and Delhi are malnourished. So now, M-Mitra will go on to the child is 5 years of age. Not only that, I'm very happy to say that we've won a program, recently Stars and Global Health Grand Channels Canada grant, we won, where we are going to actually, any child who develops severe acute malnutrition, we're going to handhold the mother for 8 months of treatment and rehabilitation process. What happens with severe acute malnutrition is that the mothers don't know what to do. They go to nutrition rehab centers in Sion Hospital and other places, but again, they don't know what to do. They go back to the slum, same situation, again recurs, and they can die. So with severe acute malnutrition, what we do is, we actually have trained nutrition counselors hand-holding the mother for 8 months of treatment rehabilitation process weekly through direct calls. We also have a customized HIV program, M-Mitra is general. On top of that, any woman develops HIV positivity, we hand-hold the mother to direct calls, giving her information on HIV, hand-holding her to the whole treatment process, the symptoms, reminders, medication, etc. till the child is 18 months of age. We also have a general call center, because what's happening is that any woman, when you know, they're getting so many calls back asking queries, that now a woman can call back with any query. Almost 300 calls a day we get, right, on asking about during pregnancy and increasing, asking just normal questions. So now our previous M-Mitra call center has expanded so that any woman with any query can call back. So I'm really indebted to Sion Hospital. You know, forming Arman, you know, it was such a hard journey, because I was a student when I created Arman. I was in first year Stanford when I created Arman. And what happens is that in this space, there are huge multinational NGOs. Really big multinational NGOs like the WHO, like the like the Gates Foundation, like Park International. Who's going to listen to a student with ideas? I was just a first year, Stanford student, right? And I mean, even when you have these ideas and you get funding, where are you going to implement them? I'm really in the Science Hospital. When I came up with ideas, and I would go to Science Hospital, they would always allow Science Hospital to be the first place that I did pilots. So Mitra has gone on to 16 lakh women, was first piloted in Science Hospital. And the journey was very, very... Let me tell you this. Brenda was the donor that gave me the first funding to implement Mitra in Science Hospital. So when you create an NGO, people are going to listen to you. For the first 5 years, it's a horrific, long journey trying to get first money in. Because you create a program, it is technology-based NGO, you create technology, but where's the funding going to come from? So 5 years, I really knocked on all doors. I was in Stanford University, so it really helped me to have that backing. However, going everywhere, no support, but eventually what happened was that in 2013, look at it, do you want to be a researcher? The first RCT, randomized cluster trial I wrote on MITS and another program of Arman won the Department for International Development UK's huge Global Poverty Action Fund grant. And we won it out of 7 applications from all over the world. It is an RCT, it's really the beauty of designing programs and designing research, and that, succeeding in international competition, and that's where the first funding came through, was something that really, the happiness of it cannot be belied, So now Arman is a place where MITRA has now won the, not only the Grand Canada Award, but also Public Health Initiative of the Year Award. And we won the WHO Public Health Champion Award this year. And this is where, the Hillary Clinton, after 5 years, when we got, I must say that when there was this whole event in Washington DC where we had the Saving Lives at Birth event. We were the only small NGO, 2 of us there, and out of 7 applications, or 800 applications, we had come to the final round, and there we won the Public Health Champion Award again in 2011, where the journey started off with Hillary Clinton giving us the award. Yeah. So the other programs of Arman. So first is MITS, which is really in 9 states. But we also have a program called M-Khushhali, which is what I realized in Science Hospital, see how the ideas that you have can lead to programs that can transform lives. What I've seen in Science Hospital was all of this in Science Hospital in the sense that, women would come to us and you would diagnose them to have hypertension, they will never come back again, right? In rural India, even if they don't even have that much kind of care, they go in, the oxygenous midwives, the ASHA workers don't remember anything, they've been trained years ago, they go to the villages, and there what happens is that if they don't understand anything, they will not pick up the high risk factors, and the high risk factors are not picked up in time, the women will not get referred in time, and even if they are referred, they don't end up going there, there is no closure of group of care, and that's how mortality occurs. So we have a program called M-Khushhali, where what we do is, again, we've created tablet-based job aids, right? So what is it? It's a digital support system. It's a digitized, algorithm where it supports the oxygenous midwife to all that she does. It takes her to the symptoms, the signs, the diagnostics. It has videos tell her how to do all of them. And when it's taking her through all of that, one of the things that it does is that, unfortunately what happens, there's a lot of bluffing, right? You cannot take a blood pressure, you cannot take, you may not do the diagnostic properly, you will not do the pulse rate, you will not do the respiratory rate. But what the job aid does is actually it starts telling the oxygenous midwife, while taking her through symptoms and signs, what's possibly going wrong with the woman, what to look out for, and it becomes, so for example, if a woman has tuberculosis, or she got cough or some respiratory condition, the app will lock down and only pulse rate respiratory rate becomes mandatory. Or else when it's an emergency, only the diagnostic required for the emergency will pop up. And she can understand that this is somebody whom she cannot bluff in. So it's really a nice decision support system. And what we do is when a woman, it tells her what the ANM can do, it also tells her when to refer the patient, and when the woman is referred, there's an SMS goes. An SMS goes to the family member, to the ASHA worker, and the doctor. that such a woman is going to come with such high risk factor, and if there is no closure of loop of care, that is, that if the woman is referred, she doesn't end up going, then another SMS will go, saying that please come in. So this whole closure of loop of care is something that we devised 3 years ago, but I'm very happy now to tell you that national government has woken up to this, and right now we're creating high-risk protocols for pregnancy, management of high-risk pregnancy for all the 25 conditions that can happen during pregnancy. And the national government managed Arman to do it. We also have created an integrated app. What happens is that the ASHA, the ANM and the Anganwadi worker do not work in integration. What happens is that they are working in their own silos, and women don't, when the obstetric midwife picks up something, the ASHA worker is not aware of what's happening. So the woman may get blessed, she may go and visit the woman, may not be aware that the woman has some big problem that she has to refer to. So what we've done is, we created an integrated solution where the ASHA, Anganwadi, ANM, all three of them have an integrated tablet, where whenever ANM does something, the ASHA workers comes to know. When the Anganwadi worker does anthropometric measurements and picks up, malnutrition, and the ANM automatically will come to know in her tablet. So what will happen with this integration is that the work is coordinated, and that, so that there's no wastage of effort, and the ASHA worker actually knows, in a prioritized manner, which are the 10 people after in the village in that particular day. So the integrated app again is something that's going to be very implemented in Maharashtra. Yeah, and so the ANM, ASHA, Anganwadi work is for areas where there is healthcare systems in place. Whereas in places where nothing exists, for example in Mewar or in Melbha, there are times where in Melbha the village is almost closed up for almost 3 months. You can't even enter Melbha during rainy seasons. Why? Because it's completely, the roads are all completely smashed out. So what we've done in such places where nothing exists, there's no primary health care system, we've created health entrepreneurs. These are women who are entrepreneurs in the sense that we train them how to do hemoglobin, blood pressure, urine test, fetal Doppler. We train them how to do pregnancy and infancy care, diagnostics. They go home to home and provide home-based antenatal infancy care. Right? So this is a study that one. So these are all our health entrepreneurs, and they earn again more than 5,000 rupees a month doing this kind of work. Lastly is HERO, Helpline for Emergency Response Operations. So, right now, I'm speaking here, one of us could have a health problem. One of us could end up in a situation where, we need ICU support, and we can't really find where ICU beds are available. Right? We could be going from hospital to hospital trying to find an ICU bed. Right? So, I had, a number of situations in Sion Hospital when I was doing residency where you would have a newborn born in the dead of the night somewhere and getting transferred all the way to Sion Hospital only to be told there's no ICU bed available or ventilator available in ICU. Or you could have situations where you had women bleeding to death, getting transferred all the way to Sion Hospital with postpartum hemorrhage. And I have personally been in situations where I would be calling, all of us would be calling 10-15 blood banks, and by the time we find where blood is available, she is dead. Right? So what you really need to have is HERO, Helpline for Emergency Response Operations. That is a real-time updated information system about availability of ICU beds and blood in all hospitals and all blood banks of Mumbai city. And the information should be available to you through phone number, an SMS auto-reply system, a website and a mobile app. It's something that is really, really important. The head of CVTS is here. We've been trying to really, if you go to Sion Hospital admission counter, the computerization has been done by Arman. So, because we want real-time information. So, it helps them in their work, and we also created a barcode inventory system for Sion Hospital Blood Bank. Right? Which we're trying to implement here because we're waiting for the systems the wiring to occur. But as I said, failure, right? HERO is a program that's really, really difficult. Emithra has really succeeded. It's a program that's easier to do, less dependable on systems to work. But HERO is a program that's really difficult, very difficult for us to convince private hospitals to come on board HERO. But we hope to do it someday, because perseverance really matters. At the end, I just want to tell you is this: follow your heart. If I had at 32, 33, not really chucked up everything and went away to Stanford University, I would not be here standing in front of you. Right? Because at that point in time, I was not doing what I really wanted to do with my life. And I, having followed my heart, I'm here standing in front of you. If I had not done that, I wouldn't be here. Right? Power of a purpose. Seriously, the thing that I really feel strongly about is that what I didn't have when I finished MD Gynec was purpose. I was living somebody else's life, right? I was told that I should become a surgeon. I was told that I should, look for being the first surgeon who did this particular surgery. You have all your landmarks, right? You do so many surgeries per day, and you go and open such hospitals, you join such hospitals. But that didn't give me joy, right? So if I had now found purpose, and my purpose was science, service, and research. I went back to that. Now I'm a researcher. I am doing science because I look at urogynecology as a field where really, I'm completely in touch with the science of physiology of the bowel and the bladder when I'm doing it, and I'm doing service through Arman, right? Keep doing. I can't begin to tell you how much because I'm here at 35 is when I went to Stanford. I finished my MBBS at 23, right? 24. Third MBBS finished at 23. So from 23, 24, 35 is a long time. I didn't know whether when I entered into residency, masters in Stanford University, I did not know where it's going to lead to. When I attended Arman in 2008, I did not know it's going to become the largest tech for health NGO in the country. Right? So I kept it, and that's the only thing because you have so many doubts. For the 8 years from 2008 to 2013 when we got the first funding for Arman, people laughed at me, right? Because, what are you doing? Because I didn't have money. I was spending all my money on Arman. I was in US 7 years, but I didn't have a car because, you can't build an NGO without money, and everything I only went into that. So people are going to ask you, right, what are you doing? But once you find your purpose and you keep at it, it really works out. And that's the fact that I am here talking about Arman and my urogynecology work is testament to that. Right? Connect the dots. Really, really important. I can't begin to tell you how Steve Jobs connected dots really works, you can't really connect the dots going forward. I can't sitting here tell you what's going to happen. I can't plan for the future. As a third MBBS student, if you want to do something, you can't decide to live your life every day upon the pattern because you're connecting the dots beforehand. Trust me, when I was third MBBS student, I wanted to be a surgeon. I didn't want to do OBGYN at all. I don't even now know how I ended up writing OBGYN in my, you had to choose. Those days, this third MBBS marks. And then you had to write your choices. You write, I wrote Gynec first choice. I wrote, my man is here, So I wrote Gynec first choice. I wrote surgery second choice. And then what happened is that I entered in Gynec, I was really like, how it is, right? It's the hardest field possible in science hospitals. And you don't really know whether you want to do this. And for a long time, I was like, I want to be a surgeon. Why did I end up in Gynec? And look at where it led me, right? Gynec is what led me to Arman, and Gynec is what led me to urogynecology and research. So I'm where I want to be. To trust life and connect the dots later. When things happen, life is what happens when you're planning. I was planning surgery, Gynec happened to me. It was the best thing that happened to me. Because every field is equally interesting. We look for, some of the people from my class who have done the best are the people who entered skin, are people who entered public health. One of my, I had my friend from Science Hospital days who did PSM, and now she is in public health England, and most people join WHO soon, and she's really doing phenomenal work. And at that point in time, we were all like, you want to do surgery, you have a hierarchy of subjects. But honestly, it's not a hierarchy of subjects, it's the subject that you find interesting. The most interesting subject in the world is biochemistry. I'm telling you this. Honestly. Seriously. Honestly, I can tell you this because, the whole point is this, that subjects choose you. And even if you don't end up with a subject that you think is your choice, in the subject you get, you're going to find so many things to play with if you do not follow others' guidelines of what is important in there. You don't have to become the next best bariatric surgeon, you don't have to become the next best CVD surgeon, you don't have to become the next best urogynecologist. What you need to do is to become the best what you want to be. That's the most important thing I learned from my journey. Very, very important, Do not let the immediate compulsions of life cloud the larger story your life can become. Extremely important. I wish somebody could tell me this in MBBS. Because MBBS is always exam. Every week I have an exam, double sir, really great, but physiology exam every week. It is killing because I was not an exam student and I had thyroid problem and, I couldn't give exams, right? But And the whole, you're going through the whole journey of exams, and then you come to a point, you're already 28, and you have life takes over, you're going to get married, you're going to have kids. But, honestly, through all of that, remember the larger story, which is not about the small things in life. I mean, the compulsions of daily life. If you have your mind fixed, or your heart fixed on your goal, your purpose. For me, it's service, science, and research. Every time I go back, I come back to do urogynecology in India. People tell me that there is no research in India. Right? You can't do research. I'm doing my 2D, 3D ultrasound work even now. I've been back for 3.5 years. I am still called internationally for the research work I do. Right? And I was telling the physiology professor I met here that I in urogynecology, a lot of physiology work I'm doing in my field, I can do in India. Right? So you can do it if you want to. Keep focused on it. Do not let the immediate compulsions, because if I come back and start thinking that's very hard to work in a corporate hospital, that nobody, it's very hard to build up your practice, it's very hard, where's the money going to come from, all of those things, little details, I will forget what I want to do medicine for. And every time keep your focus on that, because life's compulsions will continue, immediate irritations will continue, but if you keep your heart focused on the larger goal, all these irritations will seem minimal. This is very important, This is something I think is a Brahma Kumari thing. They say that destiny is not what life does to you. Destiny is how you respond to what life does to you. Really. I mean, for me, the fact that I had undiagnosed thyroid and B12 problem through MBBS MD was my destiny. Was it my destiny? No, it was a problem I faced. But my destiny was how I responded to it, right? I went away, I said, okay, I've recovered from all of it. Now life is free. I can do what I want to do. And at least I'm healthy enough to do it. So it is a response to that this determined my next journey. Right? So if my 20s are all about depression and being difficult to do residency and all of those typical problems of a student, my 30s and my 40s are of doing the thing I want to do with my life. Right? Arman, urogynecology and research. Right? Do not live someone else's life. Really important. I mean, it's wonderful. And here I'm saying no field is less than the other. I love operating, but I couldn't imagine my life being only in the operating theatre, because I really thought of medicine as both diagnostics, the beauty of diagnosis, and then treating it. And treating might involve surgery, right? But at that point in time, what I was looking forward to was that, a life where I was a laparoscopy surgeon, but I was living somebody else's life. Now I'm still doing laparoscopy surgery, but in urogynecology. And I am still following the path. I have lesser money than my colleagues, because I have taken a journey, which is a little a detour. But again, I'll get there, right? But I'm not living somebody else's life. It's really important. Lastly, it's never too late to start. Really never. I started 35. And I'm here, right? I mean, that's the whole point. Like, whatever you are at, whatever place you're in right now, I mean, you may not be, some of you may not be doing really well in studies, some of you may not be getting the marks you want to get, some of you may not be getting the subject you want to get now. Really, honestly, it's all the past. It's very true. Every day is new. And for me, when I got on my thyroiditis and I got on my B12 problem, and I went to Stanford University, was when my life really started, right? And started 36. So honestly, if you are at 25 and think you don't know what to do with your life, remember me. When I found it at 35, you're going to find it sooner than me. Thank you.